Good morning, my name is Jenny McClendon, and I'm making this video in support of a complaint that was filed against the editors of the Diagnostic and Statistical Manual and the American Psychiatric Association. I'm going to briefly recount my story. In fact, I'm going to read it, and I'm going to make a couple of comments. I'm a survivor of compound military sexual trauma, meaning more than one workplace attack. I was raped at sea by my work center supervisor, and then I was stationed at a shore command to heal from my rapes. And I was raped again by a man who appears to have known the first rapist. As a result of these rapes, I began to suffer from, and still suffer from, persistent hypervigilance, profound nightmares, bouts of depression, avoidance of military settings, and I have dissociative flashbacks that I can usually talk my way out of. While I was in the Navy, I was prescribed Zoloft to treat my upset for having been raped at sea. I took the Zoloft, and while I was on the Zoloft, the second man stalked me for several weeks and eventually pushed me into my barracks room and raped me on the floor of my barracks room. While I was being raped that second time, I experienced a number of hypersensations. I failed to fight this guy off because the hypersensations were overwhelming. And I don't really know how to describe the hypersensations. The only thing that I can clearly describe is my heart was pounding out of my chest. I understand that these can come from the Zoloft. They can also come from the sexual assault itself, or they can come from a combination of the two. The Navy psychiatrist that I was seeing at the time of this told me that my flat affect and the fact that I had not been in combat at that time had meant that I was suffering from a bipolar II diagnosis instead of responding to trauma. This diagnosis was made after roughly 3 meetings. Unfortunately, that military doctor's diagnosis influenced a VA doctor's diagnosis 12 years later. In April of 2011, after 12 years of dealing with symptoms on my own, I went to the Department of Veterans Affairs Trauma Clinic in Washington, D.C. for help with the hypervigilance, the nightmares, the avoidance. During my intake interview, I told the interviewer that I had been previously diagnosed with bipolar II, that I didn't agree with that diagnosis, and I recounted the story of the rapes. And I refused to take Zoloft when it was offered. And I explained why. When I gave that explanation to the doctor that I was being treated by the new psychiatrist, she attributed a bipolar II diagnosis to the manic episode that came from the Zoloft and or the rape or both. This wouldn't have happened if there had been warnings in the DSM-4 TR. And it certainly wouldn't have happened if bipolar II diagnosis didn't carry the weight of being a scientifically grounded serious mental illness. I was having these experiences because I had been assaulted. Nobody bothered to account for the trauma. Nobody bothered to account for what had happened. It was basically a "what's wrong with you?" I was prescribed medication at the VA for anxiety, which I was, dealing with some anxiety. Hypervigilance is anxiety. And I was offered a pill for everything. I refused most of the pills that were offered. I did take something to sleep, and I did take something for anxiety briefly. I was treated as a difficult or resistant patient because I was resistant to drug therapy. And I don't think that would be the case if I hadn't been pigeonholed as seriously mentally ill, i.e. having bipolar II disorder. A VA therapist who was other than the VA psychiatrist dismissed me from a cognitive processing therapy group. Now, she dismissed more than half the class from that group for various reasons. She decided that I wasn't suffering from anything traumatic due to military sexual assault, but what she called a foundational personality disturbance due to having been assaulted by my U.S. Marine Corps father. She referred to this as a foundational personality disorder and labeled it borderline personality disorder. Borderline personality disorder is a long-standing pattern of maladaptive behaviors. This diagnosis can limit benefits for me at the VA. It can cost me my federal security clearance, which hopefully this video and this complaint against the DSM will help with that. It could cost me custody of my children. Now, everybody knows that the VA has independent budgetary incentives for diagnosing people with childhood illnesses, pre-existing conditions. I want to mention that I'm 42 years old. I was diagnosed at the age of 42 after 7 visits with this therapist with borderline personality disorder. So she diagnosed me with a condition that should have come from childhood 24 years into my adult life. I'm 42, so I've been an adult for 24 years. Nobody that has known me for the 42 years that I've been on this earth would sign off on me having a long-standing maladaptive personality disorder. In fact, I'm the go-to person for reason for a lot of the people in my life. I'm somebody that people seek advice from. People that are my age, older than me, younger than me, my students seek out my advice. My friends, my children's friends' parents seek out my advice. Nobody that knows me would sign off on a long-standing personality disorder. However, the diagnoses that have been given to me at the VA, there's no counteracting them. There's no, 500 people that know me. Well, okay, so 50 people that know me coming forward and saying, no, there's no way that this person exhibits those symptoms in real life. Whatever you think you saw in a clinical setting doesn't match what we see out here in the real world. Nobody that works with me or has ever worked with me, probably including the people that the people that abused me in the military, wouldn't sign off on me being mentally ill to this capacity. Unfortunately, these diagnoses, they carry weight that's greater than the larger experience of my adult life. These diagnoses can hurt me in ways that no amount of reason and no amount of other testimony seems to be able to undercut. These diagnoses, they don't match the person that's telling this story. They don't match my life experience. And these problematic diagnoses can hurt my life. They can hurt my federal security clearance. They can hurt the custody of my children, although that isn't going to happen. They are affecting the amount of care that I can get at the VA. Every complaint that I make, from chronic pain to other issues that are related to having been traumatized, is not going to be treated as related to the military sexual trauma. It's going to be treated as a pre-existing condition. This person is bipolar 2, unstable, borderline personality disorder, unstable, a compulsive liar, so on and so forth. So nothing that I say can counteract the fact that I'm responding to having been traumatized in the military. These doctors have disenfranchised me as much as the rape ever did. And I'm asking for redress. I'm asking for more caution on behalf of people who apply diagnostic labels. I'm asking for the diagnostic labels to be presented as they are, as a clinician's guess. A clinician's guess shouldn't have more weight than the aggregate of my human experience. And the aggregate of my human experience is that from high school forward, I was considered a voice of reason. From high school forward, I was considered somebody that was a go-to person for academic help, for social help, for personal help. While I was in the military, people sought out my care. People sought out my guidance. I was a command career counselor at a very young age. I was a career counselor at a very low rank because I was considered to be the voice of reason. I was hand-selected for a number of assignments because I was considered to be somebody who was sharp, somebody who was intelligent, and somebody who exhibited extreme reason. How can a doctor who's seen me 5 or 6 times, 10 or 12 times, say something that counteracts that huge life experience? I want to see some redress. I want to see those of us who've been diagnosed to have more rights than we currently have. The Diagnostic and Statistical Manual applications can affect our lives in ways that really don't match what our human experiences are. And that's a human rights violation that can lead to all sorts of people being disenfranchised. I now have to register myself as a psychiatric survivor, as somebody who's not only survived military sexual trauma, but I now have to say that I've survived the abuse that comes from the people who are supposed to help you with that trauma. And that's something that we need help with. Veterans. I'm speaking on behalf of myself, but I'm also speaking on behalf of countless veterans that have been abused and traumatized, re-traumatized by the very people who are being paid by your tax dollars to help us. Thank you.